One.
Okay, so what to use in terms of equipment? I think understanding that modern dentistry is not just running around with maybe one, just because we have a mechanized float of some kind, that's the instruments. There's a comment that I get all the time, and I guess I have to get up on a soapbox for just a minute. This happens to me at least a couple times a week where people say, well, I would just do the same procedure, but I just don't have that instrument. And that's great because the instruments have come a long way. So there's no doubt that instruments are helping us a lot with dentistry in the last 20 years. Things have improved dramatically. Having said that, if I needed to, I could get the same job done with a rusty tin can and a light and a speculum. Because I've trained extensively. I've thought about dentistry. I've studied dentistry. I've worked with practitioners all over the world. I'm obsessed about it, right? And so you also have to have a skill and a knowledge base. It's not just about the instruments. I can give, all of the instruments that we have away to somebody, and they're not going to do the job. So I think it's a little bit condescending in some ways to hide behind an instrument because it takes away from our craft. And I think everybody has a craft, and I think it's important to respect other people's crafts. I can't tell the airplane pilot when I get on the plane, hey, sir, thank you very much, or ma'am, for flying me around. I would fly it myself, but I just don't have a 747 at home right now. But otherwise, I would fly to London myself. It's not really true, right? I mean, could I be a pilot? Maybe if I studied a long time, I could be a pilot, but not having the 747 is not what's preventing me from being able to do that job. So I think focusing, and the reason I bring it up is not because I care personally. I think it detracts from where we focus, especially for veterinarians, is focusing on the instrument. And I would really wish that more veterinarians would realize, focus on the skill and focus on the knowledge, because that truly is power in the mouth in terms of obtaining diagnosis and treatment. So because there's a galaxy of information within dentistry, and all the instrumentation does is obscure that by providing some illusion of competency. So really the information is key. So when it comes to instruments, though, that's what we're going to talk about, what to use. Oftentimes, simple things can make your job so much harder. So having good fundamentals. So there's two options for holding a horse's head up. I think everybody at this point realizes you can't do good dentistry or a good dental exam without good sedation, without a good light, without the horse being still. Anybody that says otherwise, it's quackery. It's just not possible. There's too many details to look for. If you're using somebody that's not using sedation, not looking in the mouth with a bright light, not in a controlled environment, there's some things that are being missed on your horse. I can promise you that. Okay, so we've got them sedated. Now we need a way to hold the head up. There's two options. There's a headstand, which has been around for a really long time. People use crutches. There's different configurations of this. This is a great tool. It's just like anything. It's the thing with all instruments, tools, whatever you want to call them, is they often have a very specific purpose. They have pros and they have cons. It's like anything. There's no one size fits all. So headstands, I really like them for certain sinus surgeries, certain procedures where I want more access over the upper part of the head, and I don't need so much down below, and I don't need to change the horse's height a lot. But horses are living animals, and they're big, and we have them sedated, but not totally under general anesthesia. So their head is going to move up and down a little bit. Their body is going to move back and forth. That's normal, and that's a rhythm that we have to learn to work with as practitioners. The thing about a headstand is it's very rigid, so if this horse moves its head back and forth, all of a sudden that changes the head height a lot. It makes it very difficult. So when we're doing hard procedures, this makes it very, very challenging. You have to have somebody that's always adjusting this, and it's never really quite in the right place. It's very difficult to be efficient with this on a day-to-day basis, though it does have some great uses. requires a little bit more labor. If you have somebody around, then that's great. Some people really like these. This is all I'm giving here is my personal preference. And I'm not saying I'm right. I'm just giving my side of the story. So feel free to take advice from other people. Okay, this is a system that I really like. It's a dental halter where within a couple seconds I can raise up the head, lower the head, and the horse is free to kind of balance its chin the way it wants. I can adjust where the halter sits on the chin to my advantage. I can do all kinds of procedures, all the dental surgeries, most of the dental surgeries I should say, we use this type of halter. We can do complicated surgical approaches or intraoral approaches. I really like this system. I typically like to work sitting down on a stool, and that keeps the horse's head height comfortable, and I can just adjust this up and down, and then I can roll around. So now, just like horses move around, I can move around. I'm adaptable, and that allows me to keep my focus on the task at hand without being so concerned about, oh, the horse's head position is constantly having to be adjusted. So these little things like this can really make a big difference. This is a great system. If you have a stock or you're building a stock, it's very, very important to have an extension that comes off of the front of the stock, and it needs to be long, at least 4 feet long, because horses have long necks. If the stock stops right here and I put this halter here, then all of a sudden the head is in between these two bars, and that just doesn't allow us to work. So a good stock for doing dental work should have a long extension that we can put this in different positions on, and that allows again for that horse to be comfortable. To have a good outcome on complex procedures, it's really important to have a good environment to work in. This setup can be replicated at the farm, in a stall, and lots of different places, so I really like it.